I may not be able to climb Everest, but I can walk, okay?
George, you all right? George?
Oh, that's gotta hurt. What we just saw was a patient collapsing as soon as he got up out of a chair. There are some specific things that can cause that. Very excited to be reacting to House MD Season 3, Episode 6, K Sarah Sarah. On this channel, we are reacting to all 177 House videos. This will be episode 70. Let's see if I can get the diagnosis before House does as a doctor working in London.
Stop it! A little bit of warning would have been nice.
Sound of a saw cutting a hole in the wall wasn't warning enough?
How the hell's a guy get that big?
All right, 1, 2, lift.
Please tell me dead guys can fart.
But a dead body can't tighten the sphincter. You need a tight sphincter to make a fart.
He's got a pulse. Give me an ambu bag and an EKG. Here, let's get him in a basket. Ready? 1, 2, lift.
This seems like an epic episode, so many things I could talk about. Our patient easily could have been buried alive here, as has happened many times in the past. Majority of cases are accidental, but in some rare cases, people choose to be buried alive, like Mr. Beast in 2021, where he was underground for 50 hours, or a Russian man in 2010 who volunteered to be buried alive so he could overcome his fear of death, but was then crushed to death by the earth on top of him. Some people are so scared of being buried alive, which is called taphophobia, that a safety coffin actually exists to stop it happening. One was from the 1800s that actually had a mechanism that can erect a ladder for the not so deceased so they can climb up out the ground if they woke up. Just in case they were too weak for that though, it was also kitted out with a nifty bell to alarm those fine people around you that hang out in graveyards to come to your aid. We know this patient's almost 600 pounds. Why is that? What caused this dance with death? Let's get more clues.
It's almost 11. Where is House?
And I shouldn't be here. I know you can hear me. What took you so long?
Sorry, I didn't have 15 grand in my loose change jar.
Guy wanted to punish me. He did it. It's over.
Better get yourself a lawyer.
Start treating Jabba for Pickwickian syndrome.
Ah, Pickwickian syndrome. That has an interesting story. Another name is obesity hypoventilation syndrome, but got called Pickwickian syndrome after a Charles Dickens novel called The Pickwick Papers. In it, a boy who's rather large keeps falling asleep, snoring loudly, and missing out on good fortune because of it. Like, at one point, he got dealt a full house playing poker, but missed a hand because he snored his way to folding. We do prefer to use obesity hypoventilation syndrome now, as it refers to the shallow breathing some people with severe obesity take as they're unable to keep their oxygen levels high due to the weight on their chest. You may have also heard of sleep apnea, and the two are quite related, although sleep apnea relates to short episodes where people stop breathing while asleep. The treatment for it is something called continuous positive airway pressure, which is a mask that helps the airways open and allows a person to stay oxygenated because of it. Interestingly though, this patient, even being as large as he is, they've mentioned also has normal metabolic markers, no diabetes or high cholesterol. Surely there's got to be a condition that causes this much weight gain. Even more interesting than that though is you may be wondering why House had to be picked up from jail. Well, he was rude to a patient as usual and picked the wrong enemy, a detective. Things then escalated, patient tripped him up. House then put a thermometer in his rear, well, the patient's rear, not his own, and then left him there in a full spread without coming back. The guy at Twitter doesn't just want revenge, he wants blood. So House has a massive target on his head now, and something tells me this isn't over.
Talk to the neighbors, search the house.
It's hard to believe you can even attach this much flesh to a human skeleton.
This is ridiculous. A person shouldn't be able to eat themselves into oblivion and then just expect everyone to pull out the stops to fix everything.
It's easy to fall into the trap of what Chase is saying here, especially when you look at universal healthcare. In the US, you could say, well, this person may be paying for their insurance or not be able to afford treatment and so won't have access to it. There's not really a bill for the taxpayer to pick up there. But in the UK, 6.5 billion a year is spent on paying for obesity and obesity related treatments. That is a huge amount of money, so why should the taxpayer be held responsible for it? Well, I can think of at least 3 strong reasons why. Firstly, obesity isn't just caused by people eating too much. We know that foods high in saturated fat and sugar are cheap and easily accessible. Fresh fruit and veg are getting even more expensive in a time that people's disposable income is getting thinner than Dwayne Johnson's hairline. To give you an example of just how bad this is, there are people in the UK that see having a French fry sandwich as luxury. It's hard to think of diet planning if you don't know if you'll have somewhere to live next week. 1 in 30 people in the UK don't even have a fridge. There are also genetic factors that make people more susceptible to weight gain, which are beyond people's control. Secondly, even if it were true that obesity is fully self-inflicted, then why not open up this conversation to other self-inflicted conditions? Should people who smoke, drink alcohol, have processed meat, don't wear sunscreen, or use Q-tips in their ears be disqualified for healthcare free at the point of care as well? Do you see how quickly that line of reasoning gets ridiculous? Thirdly, paying for obesity treatments is actually very tax efficient. Let's say you have a 30-year-old obese patient with a BMI of 60, which is severely overweight. If that patient develops high blood pressure, diabetes, and loses a foot, their lifetime care costs will begin approaching £1 million. Or they could have a £40,000 gastric bypass operation, lose the weight, gain their mobility and independence, and avoid all these complications. It just makes sense, it's cheap and effective. This all reminds me of a case recently of a guy who in 2013 was called the fattest man alive. 610 kilo patient named Khalid bin Mahsen Shari, who was twice as heavy as the patient in this episode. His BMI was 204. At that point, one of the Saudi royals ordered that he be transferred to a Saudi hospital in Riyadh to undergo intense physical rehabilitation. The details of what happened there are pretty much hush hush, but what we do know is that in just 5 years, he lost over 500 kilos. That's the weight of a bison. There are other reasons to help obese people as well, like when people feel supported, then they're more likely to engage and have healthier lifestyles. So let's give our man the time of day, as maybe we can turn his life around. So question for you smart people, what percentage of people are classed as overweight and how many are obese? Answers down below.
We don't give drug addicts dialysis or alcoholics liver transplants.
Does George have a job? He has a headhunting business he runs from home. Sometimes women do come by. Young, attractive, never the same one twice, if you know what I mean. There can't be many women who'd want to be with a guy like him.
Oh, that last line was definitely painful to listen to, but sadly could be true. It isn't just George here that has to resort to sex of the paid persuasion though. Around 3 or 4 years ago, the Washington Post published an article showing that 30% of men under 30 haven't had sex in the last year. That's been quite a worry recently, as it's thought that sexlessness, social anxiety, insecurity, and mental health are all intimately linked in this age group. So one man, let's call him Peter, says that he feels the need to inflate how skilled he is in bed before it comes down to performing. Then, when the opportunity arises, the pressure feels so much that he can't actually perform. That's happened 4 times in the last year, and the anxiety has gotten so into his head now that he says he feels the need to be absolutely beautiful to even think of himself good enough to speak to a woman that he's mildly attracted to. But he's gained weight from drinking too much and is worried of embarrassing himself again. That isn't the exception either, as up to 40% of men are anxious about their weight and 85% believe that they're not muscular enough. Experts think part of the problem could be social media, easy access to pornography, shrinking social circles, and that men generally don't share their feelings or take part in body positivity movements, which have mainly been focused on women. It seems that a lack of sex is part of a broader sense of disillusion in many young men's lives, feeling unsatisfied with their social lives, their careers, and their sense of selves. It's a serious societal problem, and unless it comes to the spotlight, it can have disastrous consequences. But we've already seen members of the Incel, which means involuntary celibate, community perpetrate terror attacks. In 2018, a man drove a van into pedestrians. He stated, "The Incel rebellion has already begun. We will overflow all the Chads and Stacys." Of course, not all men that aren't having sex will start driving vans into people, but there's definitely a wider societal problem that needs to be addressed.
So your arm only hurts after you lie on top of it all night?
Yeah.
Well, there's always surgery.
You want to remove my arm? Are you insane?
Actually, spending a night in jail hasn't humbled you a bit.
He's got a fever now.
MRA his brain, look for clots.
Weight limit on the MRI machine is 450 pounds.
Then just start treatment.
His head's the only part that we have to get in the machine.
Are they gonna do what I think they're gonna do? This episode is absolutely bonkers. Somehow House got that the patient has a stroke from him having a fever, which is like saying doing backflips is a symptom of toe arthritis. Now in real life, believe it or not, if we have situations like this, there is a solution. We have to do the MRI scans at the zoo. Our limit for the hospital MRI scanner is up to £420 before needing to send those zoo referrals. The problem generally isn't just that the bench isn't strong enough to hold them, it's that the MRI machine is quite a confined space and that patients who are above that level are more likely to suffer from thermal burns as a result of the machine. There was actually a case of a 45-year-old obese patient who got a full thickness burn from an MRI machine because she had such anxiety that she needed to be sedated, and while sedated she couldn't complain of pain, which led to her whole right elbow getting fried and requiring surgical management. Now House told the team to treat for stroke caused by clots if they can't do a scan, but if he's bleeding then that will definitely kill him. Crazy. So
The weight limit's obviously just an estimation.
Adrenal insufficiency could cause a temporary coma.
Just do a full STD panel and check his genitals for chancres.
Or we do all of the above.
he woke up. Who knew that all it would take is a broken $1 million MRI machine? At least now they know his scan was normal. Could it be that whatever it was heat sensitive? Maybe the heat from the MRI is what triggered him to wake up. We know hypothermia can cause comas, but surely the team would have recognized that. Maybe we need to take a step back at what could bring this whole case together. We know he's had exposure to sex workers. We know he stays at home. We know his sugars are normal despite him being so large. What if he has an insulinoma? The cells in his pancreas become overgrown and start producing insulin at record high levels. Maybe he used to have diabetes and it corrected the sugars, but now it causes him to put on weight and get more hungry as it stores the glucose inside his blood in the cells, causing him to gain that weight. He then needs to eat more to keep up with the production and the vicious cycle continues. Then what happens when he can't keep up anymore? That tumor spits out more insulin than his body can handle, dropping his glucose and putting him in a coma. Would explain everything so perfectly. I'd say that's my first diagnostic guess.
I have nystagmus. I've had it since birth. I'm fine. When can I go?
Skin exam and ACTH stimulation tests were both normal.
Blood and urine were negative for chlamydia, herpes, and syphilis.
What are you doing here?
Executing a search of the premises. There's got to be over 600 Vicodin in here. Proves intent to traffic. Now, maybe just a few of these are in someone else's name. You wouldn't do that, right?
House is in deep doo-doo. There is no way all those are legally prescribed, especially with the prescription of drugs of abuse. We keep track of when and how the last batch was sent to avoid this exact thing happening. Even that doesn't work to stop illegal reselling, as many of the drugs we prescribe have a significant street value. Back in 2017, a patient was caught undercover by a BBC documentary selling taxpayer-funded meds illegally on eBay.
So do you get it on the NHS then? Yeah. This is £800 at the pharmacy.
Seriously though, why does House need hundreds of Vicodin boxes? I previously thought he was just using the meds as a coping mechanism with the pain, but now he's definitely showing addictive behaviors. I wonder why the producers chose Vicodin though, as specifically it's not that addictive. Oxycodone, fentanyl or Valium would have been a much easier sell, but Vicodin does have a ring to it. I actually wonder how much the company that makes Vicodin made from their publicity in House. Definitely good free advertising. One thing is, I bet House is regretting that thermometer decision on Twitter now. If you're not regretting clicking this video though, then check out the channel membership. You get early access to new videos, priority reply to comments, and to suggest a video and series for me to react to. The first 30 members have a chance to win a 1-hour, one-on-one tutor session with me on a topic of your choice. We currently have 27 members with just 3 spots left. So press join now to secure your spot.
He knows what's wrong. He's just too stubborn to admit it.
You would never give up this easy if you weren't so busy dealing with your own personal problems.
What'd you tell that cop?
He called to see if I prescribed the pills. I said yes, that's all. Well, I'm not the one who put a thermometer in his rectum. So stop yelling at me and start talking to your lawyer.
I may not be able to climb Everest, but I can walk, okay?
George, you all right?
Oh, that's gotta hurt. What we just saw was a patient collapsing as soon as he got up out of a chair. There are some specific things that can cause that, and we call it postural hypotension. The common things are prolonged bed rest, dehydration or anemia. The spicy house-esque causes are things like postural orthostatic tachycardia syndrome or POTS. Could still be insulinoma, although it doesn't classically cause this, or it could be a carcinoid tumor over-secreting serotonin. If I saw a patient like this, I'd definitely need to assess in an A to E fashion. First check airway, then breathing, then circulation, then disability, and expose to make sure there's no glass in his abdomen or injection marks where he's poisoning himself. Very much enjoying this episode. Interesting double storyline with Tritter and this pretty hard case to crack.
I didn't think he should be discharged, so I gave him 3 grams of phenytoin.
Discharge report says he didn't eat his breakfast.
It can't be Chagas. He's never been outside the country.
Food we eat no longer comes from America's heartland. Get a sample of his CSF.
He's too big to do an LP.
You want to drill a hole in my head. This is what I get for eating salad. I can't see.
No, what did you do to me?
Oh, that is a big clue. The team wanted to take a sample of his spinal fluid to try and confirm Chagas disease. It's the parasite with the highest burden of disease in the Western Hemisphere. Usually it affects people in Mexico, northern parts of South America, but can spill into the southern US. Most people that are infected don't have symptoms, but those that have it can get fever, enlarged lymph nodes, muscle pains, and headache. In severe cases, they can get encephalitis, but we would have been able to see that on the MRI that they wrecked the machine to get. There is a classical sign called Romagna sign where you get swelling around one eye 1 to 2 weeks after being infected with the parasite. I'm surprised they wanted to do an LP, as you could just do a blood test to diagnose it, but where's the fun in that? They couldn't do an LP because the landmarks would be obscured, so they decided to drill into his head to get the spinal fluid instead. Maybe he lost his vision when they did that because he already had low levels of spinal fluid, and them removing some crashed the levels. There is a condition called spontaneous intracranial hypotension that's usually because of a spinal fluid leak that causes headache, but which our guy doesn't have. He does have fever as well, which does match infection or autoimmune rather than a structural cause. Really struggling to come up with causes that match this one, except the insulinoma, to be honest.
The blindness has to have been caused by something in his brain.
You look for a disease that has nothing to do with my size, and I will help you. Otherwise, leave me alone.
I'm inclined to think your particular charm may not be immediately appreciated by a jury.
What'd your lawyer say?
That a smile like mine can't lose. What about diabetes?
Won't let us test him.
I am not diabetic. Get the hell off of me. Get the jackass off of me.
Just in case Tritter didn't have enough to prosecute House with, he's trying to add assault to the list. Seems like his shenanigans led him to see the hand close up, and it's not that obvious, but he may have digital clubbing. It's regarded as the oldest sign in clinical medicine and was described by Hippocrates almost 2,500 years ago. It's sometimes called drumstick fingers. Systems that cause it include the heart, lungs, and liver. Heart could be congenital cyanotic heart disease, but then he would have been unwell from birth. Infection of the heart could cause clubbing as well, but that would also cause stroke, splinter hemorrhages, and a murmur. Lung causes could be cancer with a paraneoplastic syndrome. It could explain the weight gain, fever, dizziness, and coma as well. I'm definitely going for that as my second diagnostic guess, especially since lung cancer actually causes 80 to 90% of digital clubbing cases. But House loves common, like goldfish loves tap dancing. Liver could be hepatitis or cirrhosis as well. Again, would have shown up in the blood tests though.
Get x-rays of his hands. You didn't notice his fingers? They're not just fat, they're clubbed.
You have a small cell lung carcinoma. Caused a paraneoplastic neurologic syndrome, which in turn caused your blindness and coma. It's inoperable.
I never smoked. C'est la vie.
Wow, I can't even celebrate getting the diagnosis with that blow. Around 10 to 20% of lung cancers are actually in people who have never smoked or had less than 100 cigarettes in their life. That being said though, smoking increases your lung cancer risk by 15 to 30 times. You never know what cards you're going to get dealt, but if you've tipped the dealer, then I'd fancy your chances. It's easy to get annoyed by this episode. I could make a strong argument that the writers are saying you can abuse your health and it doesn't matter matter because something else will kill you anyway. They don't mean that though. I'm sure the message is that life is random. Enjoy the time you have because no matter what happens, we're all gonna be in the ground at some point. That doesn't need to be a bad thing though, as finitude is what gives us meaning. Mexicans know that, that's why they party in graveyards. Now it seems like the only thing less operable than the patient's cancer is House's chances in court.
He needs the medication, which is why I prescribed it.
Because the signatures on these look a little different than the signatures on those. You look surprised.
I guess I get bored signing it the same way. I am sure.
Thank you for your help.
Wilson is putting his career on the line again to defend House. I'm loving this arc. Prescriptions now are mainly electronic, so this signature thing is becoming a thing of the past. Believe it or not, physical prescriptions and their pads have a really high street value for this exact reason. People steal the pads and prescribe themselves drugs of abuse. In our GP surgery, we actually have to lock the prescriptions away to stop them being stolen, even though they're technically just a green piece of paper. Can't wait to see what happens after this. It's a 9 out of 10 for this episode, 7 out of 10 accuracy, 8 out of 10 diagnosis. This episode makes way more sense though when you watch the previous one where House discovers something a couple don't want to know here.